Bismillahirrahmanirrahim. Today we're going to talk about the tibia. Now, the tibia is one of the two bones of the leg region, and it is just like a typical long bone. It has three parts. It has an upper end, it has a lower end, and it has a shaft. Now, in the leg, there are two bones. You have the tibia and the fibula. The tibia is the medial of the two, and it is the much larger of these two bones of the leg. Now let's talk about the side determination of tibia. First of all, you have to consider that it has an upper part and a lower part. Now the upper part is much larger and much more expanded as compared to the lower part. So the upper part has two condyles, a medial and a lateral condyle. So when you're holding the bone, you have to know that this is the upper end of the bone. So you're not going to hold it like this, you're going to hold it like this, right? The second thing to remember is the anterior border of the tibia. Now the anterior border of the tibia is the one which is just underneath, which it starts from just below this tuberosity. Now this tuberosity is known as the tibial tuberosity. So the anterior border, it is the most prominent of the borders, and this anterior border is S-shaped. It is curved. Now it is curved in such a manner that in its upper part, the curve is towards, the convexity of the curve is towards the medial side, and in the lower part, the convexity of the curve is towards the lateral side. So after you've seen or you've determined that this is the upper end and this is the lower end, the second thing to do is to see where the anterior border is. So just underneath the tibial tuberosity, you have the S-shaped anterior border. After that, the third thing is you have to determine the medial and the lateral side. So on the medial side of the lower end, you can see that the medial side of the lower end projects down quite a bit, and this part is known as the medial malleolus, right? So this is the medial side. So when you consider all these three things together, this is the upper end, the lower end, this would be anterior, and this would come towards the medial side. You can determine the side of your bone, and in this case, this is the right tibia. Now let's talk about the upper end of the tibia. So this is the expanded upper end of the tibia, as you can see here. This is the the upper end is expanded in the form of two condyles, right? There's a medial condyle and there's a lateral condyle. Because the tibia articulates with the two condyles of the femur to form the knee joint, so it has two condyles, the medial condyle and the lateral condyle, and the superior surfaces of these condyles serves as the articular surface where the articulation in the knee joint takes place. So now we're looking at the upper end, and we can see the two condyles. Now this is the posterior surface of the tibia, and that would be the anterior surface. So here we can see the articular surface. This here is the medial condyle, because this is the right tibia, and this is the lateral condyle, right? And in addition to these condyles, the upper end also has an intercondylar area. This here is the intercondylar area. Okay, so I've decided to use a pen so that it's much easier for you to understand the point that the area that I'm pointing at. So this is the medial condyle, this is the lateral condyle, and in between these two, this part here is the intercondylar area, right? So in addition to these three parts, the upper end also has a tuberosity that we just talked about. This part here, this is known as the tibial tuberosity, and this is the part where the ligamentum patelli is inserted. So moving on to the medial condyle, all of this is the medial condyle. The medial condyle is obviously on the medial side. It is much larger than the lateral condyle, and if you look at it, the medial condyle is larger and more oval in shape. It is more oval in shape because the anteroposterior diameter is larger as compared to the transverse diameter, so it is more oval in shape as compared to the lateral condyle, which is slightly more circular. The medial condyle is the one which articulates with the medial condyle of the femur, and similarly the lateral condyle would then articulate with the lateral condyle of the femur. Now, when it comes to the articular surface of the medial condyle, on the periphery it is flat, and this is the part where a cartilaginous meniscus is present all along this periphery of the medial condyle, and this meniscus actually deepens this articular surface of the medial condyle. In the center there's a slight depression, and on the periphery the meniscus is present. So when it comes to the lateral margin of the medial condyle, the lateral margin of this articular surface is raised. You can't see it here, let me show it to you like this. So here you can see this is the periphery where the meniscus is present. Here there is a slight depth, and this lateral margin is then raised, right? And here you will have the medial intercondylar tubercle. Now when you look at the posterior surface, the posteromedial surface of the medial condyle, you can see that there is a groove here. So there is a groove on the posteromedial aspect of this medial condyle, and this groove is where there is attachment or the insertion of the semimembranosus muscle. Now we're going to move on to the lateral condyle. So this is the lateral condyle, and the lateral condyle is more circular and smaller than the medial condyle. Now the lateral condyle, if you look at it from this perspective, you can see that it overhangs the shaft more than the medial condyle, right? When you look at the articular surface of the lateral condyle, you can see that again, just like the medial condyle, the periphery of this articular surface is flattened, and this is where the lateral cartilaginous meniscus would be present, and in the center of this articular surface there is a shallow depression. And when it comes to the medial margin of the lateral condyle, this is elevated, and here you will have the lateral intercondylar tubercle. Now this area in the center is the intercondylar area. Now when you look at the postero-inferior aspect of the lateral condyle here, let me just move it a little bit so hopefully you can see it better. This part here, there is a facet here, and this is the facet for articulation with the fibula, right? So this is the lateral condyle, and on the postero-inferior aspect of this lateral condyle there is a facet, and this facet here forms articulation with the fibula to form the superior tibiofibular joint, just like in the upper limb where you had the radioulnar joints, the superior and inferior radioulnar joints. In the leg you have a superior and inferior tibiofibular joint. So this facet is the one which accommodates the fibula to form the superior tibiofibular joint, and this facet is on the postero-inferior aspect of the lateral condyle, obviously because the fibula is the lateral bone and the tibia is the medial bone of the leg, right? So after that you can see on the lateral condyle, on the posterior aspect of this lateral condyle here, there is a groove, right? So here you had the facet for the fibula, and here there is a groove, and this is the groove which accommodates the tendon of the popliteus muscle. Now on the anterior aspect of this lateral condyle, so this is the lateral condyle. On the anterior aspect of this lateral condyle, here there is a Gerdy's tubercle, right? So this thing here, this is known as, it's a facet where there is insertion of the iliotibial tract, right? So this is known as the Gerdy's tubercle, where the iliotibial tract gets inserted onto the anterior aspect of the lateral condyle, right? So I had moved it like that, right? So this is the medial condyle, this is the lateral condyle, and here you have the Gerdy's tubercle where the iliotibial tract gets inserted.